Okay, so I'm just going to do a surroundings check so that way you can see I don't have a rubric. Nor my messy kitchen. Okay, nothing on the table. Okay, just gonna set this up here. Knock, knock, knock. Hello, my name is Mackenzie. I'll be your student nurse today. Provide for privacy, washing my hands. Can I get your name and date of birth?
John Doe, May 8th, 2001.
Okay, and I'm just gonna check your wristband, and that does match. And Joe, do you have any allergies today?
I do not.
Okay. So I'm just going to check my physician's orders, and it shows that we're going to put in an IV. I am going to use a 20 gauge as that is going to help with the normal saline that we're going to put in. It's the best one that we can use. And before we get started, I'm just going to check all of my items, making sure that they're intact and that they are not expired. Okay. And then, Joe, are you in a comfortable position?
Yes.
And then I'm going to make sure your arm is in a dependent position. I'm going to put this linen saver under your arm. Okay. So first, before we get started, I'm just going to get my J-loop ready. So we're going to open up our our saline flush. And we want to make sure not to touch anything on the inside, keeping it a nice sterile field. Okay. And then I'm going to open up my J-loop here. And then again, just being careful what I touch on the inside. But I'm just going to grab this, and we're not going to touch that. We're just going to connect the two here. And then we're just going to flush our J-loop. Okay. And then that will be ready for me when I am ready for it. Alright, I'm just going to wash my hands again, and then I'm going to put on a pair of gloves. And for demonstration purposes, I could only find one glove, but I would be using two. Putting on my other glove. Okay, so I'm going to open up my IV start kit. We're going to grab out our tourniquet here. Set that there. I'm not going to put it on quite yet. I'm just going to grab out the tape as well, and then grab all my tape pieces. And just set that to the side, out of sight. Okay, so I'm going to put on our tourniquet. Okay, and then I'm just going to palpate the vein that we're going to use. And then I'm going to take our cleaning supplies, and if this was an alcohol thing, we're just going to scrub for 30 seconds. It's been 30 seconds. So I'm going to take our tourniquet off, keeping it there. We're going to let that dry, and as that dries, I'm just going to grab our needle. Just going to open it here. So that's ready for me, so I'm just going to put on the tourniquet again, and I'm going to make sure not to touch the site of where I cleaned. And I'm going to take this out. I'm going to inspect the tip to make sure it's intact. Okay, Joe, so you're just going to feel a little poke. Ready? 1, 2, 3. And then we're going to start inserting, and then I do see a flash of blood. I'm going to take off that tourniquet. So that way, okay. And then keep inserting, and then take off that needle, but keeping that catheter in. Go. And then that's when we'll grab this. I did see a flash of blood at that point. And then again, making sure we're not touching other than end to end. There we go. Okay, so that is in now. And then we can flush 3 to 10 milliliters of saline, or the flush here. And at that point, I'm just gonna lock this so that way nothing comes out there. And then we can undo this. So then I'm going to grab, just in case there was any mess, we're gonna grab our gauze and just clean up underneath. Okay. And then I'm gonna grab the Tegaderm and just put this, not on the catheter itself, but kind of just on that hub area. And just set that over. Okay. And then we're gonna grab our tape and just help tape down that J-loop as well. Sticks really well to Joe here, that's for sure. Oh, you're kind of falling apart there, Joe. Okay, so I am then going to take on the Tegaderm, there is a little label, and we're just going to put the date, time, my initials, and then the catheter gauge, and then just stick that right on that Tegaderm. Okay. Joe, do you have any questions about what we did today?
I do not.
Alright. And then we're going to do our safety checks, just making sure that is locked in low, side rail secured, call light within reach, all of that. Okay. Thank you.